I'm Doug Abel, Vice President for Public Affairs and Communications for Harris County Medical Society. Welcome to the second episode of our Artificial Intelligence in Medicine series. Today, we'll be discussing the potential benefits of using AI to assist you with that burdensome task of claims filing. I'm joined today by Dr. Eddie Patton, a neurologist here in Houston for 14 years, who has been using various forms of AI in his practice for several years. Welcome, Dr. Patton.
Thanks for having me. I'm glad to be here.
The goal of this series is not only to educate our viewers about the artificial intelligence, but also to get them comfortable with the idea of slowly integrating AI into the various aspects of their practice. During the first episode, we provided our viewers with a brief overview of the top benefits of artificial intelligence in healthcare. But today, I'd like to drill down and focus specifically on a potential benefit of reducing the administrative burden that comes with claims filing and dealing with health plans. Right now, we are starting to see a trend in healthcare where health plans are using AI as another means to deny claims. In fact, we have an article from the Healthcare Financial Management Association that states that initial claims denials over the last 3 years have increased by about 2% over the past 3 years. There are also reports that some Medicare Advantage patients are having claims denied when the payers use AI. And in similar cases with the same service, patients who had humans review their cases had their claims approved. Finally, we see last year, United Healthcare and Cigna were both hit with class action lawsuits claiming that they were using AI without physician oversight, and that this was having a negative impact on patient care. This is a trend that is alarming to Harris County Medical Society, and we've been working with our government representatives to address this issue.
Yeah.
But that said, Dr. Patton, can you give us some tips, some ideas of how physicians can utilize AI to their own benefit and help balance out the playing field and when it comes to filing claims?
Absolutely. I'd be glad to, Doug. And when we initially talked about the broadness of AI, the claims process and documentation process with the use of AI in clinics, in my opinion, is going to be where you're going to see the early adoptability, where clinics will really be able to start using AI. But it's important for every physician to do his or her research, to understand the different applications and figure out what type of AI technology works best for their clinics. But we have to keep a couple of things in mind. Number one, AI in healthcare is still in its infancy. I mean, it's the beginning stages. And these systems are designed to learn from itself, so to speak. It works by creating these algorithms that build and grow and learn from itself. So the saying goes, garbage in, garbage out. So we have to be very careful about what we're putting into these systems so that they learn and they take that data and apply it to clinical practice. But let's start off by talking about data entry, which is one of the simplest ways in which you can quickly incorporate AI into your clinic. So one of the most cumbersome tasks that in clinic we found, especially after the Affordable Care Act, is the amount of volume of information we have to put into our charts, documented, the amount of time with documentation. And then that information is being used then to either accept or deny claims. So what AI can do in simple terms, in what's called ambient AI, meaning kind of background AI, is listen to a visit where the physician can actually spend more time face-to-face with the patient. And then it takes that data and puts it into the format in the EHR. The other application for that is that it's learning from what the insurers are looking for as far as their claims and filing. And it can extrapolate that data and almost clean up the note for you before putting it into the EHR. So that's a way in which information can be automatically generated into clinical notes And those notes are then used to make the claims that go to the insurance companies.
So just to be clear, this isn't the same thing as the copying and pasting function within the EHR that got a lot of physicians in trouble when that first came out, right?
Now, I think it's different because when you're talking about copying and pasting, it's a shortcut where you're taking previous information so you don't have to repeat it. You're just kind of copying that information into your visit going forward to either add more information or to satisfy, okay, let you know where you are in that patient's history. With this technology, you're actually real time listening to the live visit, and through artificial intelligence, it's able to take the information and the conversation that you and your patient is having and put it into the appropriate format that's designed by the EHR, and then take out any extra stuff that's not really needed. So that I think is the main difference between this and like copy and paste.
Okay, good. Because we want to keep physicians out of trouble here. We don't want to go down that road. Right?
Absolutely, absolutely.
Okay, so the next thing that let's talk about is something that we get here at Harris County Medical Society. We get a lot of complaints from physicians because their claims are rejected due to quote unquote errors. So as you're talking about AI as a learning about the physician's behavior and some of the responses they get from patients and things like that, can AI assist the physician in minimizing those errors or even preventing those errors from occurring, which then would reduce the number of denials that the patient or the physician receives?
Yeah, I absolutely think that AI has the ability to do that. One of the most frustrating things that we face is after you see a patient, based on your education and training, you identify what you want to do for a patient. You write that order, and you find out whether it be a couple of days, a week later, that it's been denied. And it's very frustrating. It leads to delay in care, for patients. And a lot of those denials, we don't even know why. It could have been just a simple typographical error that we left out of the note and so forth. So with a system like artificial intelligence that's behind the scene, kind of scrubbing your note, going through, and this technology knows what information the insurance companies use to either deny or approve a claim, it can in real time look at the information you're putting in and figure out if that information is there and if it's or if you need to add it. So if you think about that in real time, it should lead to more successful claims because rather than going back, getting a denial, then going back and having to add that information later, if an autonomous system with algorithm that has an algorithm base that can look at that information, it should be able to tell you real time what's lacking and the chances of your claim being denied or approved.
And all that makes perfect sense theoretically. But do you have experience, or do you have colleagues that you know of that have had experience with products that are out on the market right now where they've actually seen a reduction in claim denials?
Yes, I've heard from colleagues specifically, and there's even documentation. There was one practice, it was documented as far as reduction in claims in one organization, saw a 55% reduction just from using an AI, augmented intelligence, or artificial intelligence tool. So this is real time, and it's real, and I think it can be a value add to practices, so that you don't have to spend time on going back and doing, the authorizations and spending time. If you have a system in place that can take what you're doing, the information that you're putting in, and tell you ahead of time what is either needed or not needed to get the process moving forward.
So in talking about reducing the amount of staff time that it takes to monitor these things, to track these things, is that something that AI can do in terms of tracking these claims and being able to say, alert staff if there is a change, if there is more information needed per se, or something like that, but where the computer can basically track and monitor what's going on instead of the individual having to spend so much time during their day keeping an eye on it.
Yeah, in the past, you had no idea what was going on. Once you make that order, make that claim, you either heard it from your patient because something has been denied, or you get a letter by either a snail mail or email or some other way. But when you think about how artificial intelligence is going to help this process moving forward, it's not just inputting the data and making the claim. It's also tracking that claim through the process. So you will have the ability to know real time where things are and how things are going, whether additional information is needed or, where the process is going within the process. So not just inputting the information, but also tracking that claim along the process is a way in which AI can help with the administrative burden that we face on a day-to-day basis.
So this sounds like that it can be a real game changer, both in terms of reducing that administrative burden of the physician, but also improving the overall efficiency of the office, of the practice, to allow, for example, your nurses to go back to doing nursing as opposed to tracking documents and doing all of those kinds of things.
Yeah, anything that we can do to reduce the amount of time that we do in these administrative tasks, like just figuring out, did I add everything in my note that I needed, or I've written for this prescription several times, it gets denied because the insurance company usually wants to know A, B, and C. If there's a system or a program in place that learns from what the insurers need and what we are putting in and can do that, it will greatly reduce the amount of time that I spend doing that and my staff with following these claims and figuring out how to get this approved for the patients. And there's more time that I'll be able to spend face to face with the patient, which is really what medicine is about. It's about the patient-physician relationship, and anything that interferes with the amount of time and face time that you get with me as your physician, we can figure out ways to minimize that. That'll help the physicians overall. And I think it'll enhance patient care.
Absolutely. That is wonderful information. So, Dr. Patton, I appreciate you being here. I hope that this piqued the interest of your colleagues into looking more into AI and to look at how they could implement that into their practice, what's appropriate for them, what they like about it, what they don't like about it. Unfortunately, that's all the time that we have time for today. But we always want to end these podcasts with the reminder to always check for accuracy when you're using AI. It is not a substitute for you or anyone else. Every physician needs to check for accuracy. So thank you so much, Dr. Patton, for your time. We appreciate that. And we thank you for watching. And until our next episode.
Thanks for having me.
All right.